Hey everyone, Dr. Alan Mandell here, and today I want to ask you something really important. Have you noticed that it's getting a little harder to get up from your favorite chair? Maybe you reach for the armrest now, when you used to just stand right up without thinking. Or maybe you've caught yourself grabbing the wall when you walk to the bathroom in the middle of the night. Or your legs just feel heavy, tired, like they don't respond the way they used to. If any of that sounds familiar, I want you to know something. That is not just aging. That is your body telling you it needs the right signal. And that's exactly what we're going to give it today. I'm going to show you 4 exercises that most doctors never talk about, that most people completely forget about, and yet physical therapists have been using them for decades to help people over 60 get their balance back, get their circulation moving, and rebuild real functional leg strength. No gym, no equipment. You can do all of these at home, starting today. Now here's what I want you to do. Stay with me through all 4, because exercise number 3 is the one almost everyone skips, and it might actually be the most important one for keeping you safe and independent. So don't skip ahead. Let's get into it. First, I want to spend just 2 minutes explaining why this happens, because once you understand what's going on in your body, these exercises are going to make a lot more sense. Problem number 1, muscle loss, what we call sarcopenia. After age 60, the average person loses between 1 and 2% of their muscle mass every single year if they're not doing anything to stop it. That doesn't sound like much until you do the math. By the time you're 70, you could have lost 20% of the muscle you had at 60. That's why the legs start to feel weak. That's why stairs get harder. That's why getting off the floor feels like a major project. Problem number 2, your proprioception starts to decline. Now, proprioception is a big word, but the concept is simple. It's your body's internal GPS, the system that tells your brain where your feet are, where your weight is, whether you're balanced or about to tip. After 60, this system gets less accurate. The signals slow down, and the result is that you feel less sure-footed, less steady, and that's a big reason why falls become more common. Problem number 3, circulation slows down. As we age, the muscles in our blood vessel walls weaken. The valves in the veins of our legs, the little one-way gates that push blood back up to the heart, they get weaker too. So blood starts to pool in the lower legs. You feel it as heaviness, as puffiness around the ankles, as that tired, achy feeling by end of day. And then there's problem number 4, and this one is sneaky. It's what I call the fear loop. You feel a little unsteady, so you move a little less to be safe. And because you move less, your legs get weaker, and now you're even more unsteady. It becomes a cycle that feeds itself. Here's the good news, and I mean genuinely good news. These 4 exercises target all 3 of those problems at the same time: muscle loss, proprioception decline, and circulation. Let's start with number 1. Exercise number 1 is called heel-to-toe rocking. Now, I know what you're thinking. That sounds too simple to do anything. And that's exactly why it's on the forgotten list. People underestimate it. But let me tell you, this is one of the first exercises used in stroke rehabilitation for a reason. Here's what it does. When you rock from your heel to your toes and back again, you activate what we call the calf pump. Your calf muscles are not just for walking, they're actually your second heart. Every time those muscles contract, they squeeze the veins in your lower leg and push blood back up toward your heart. When those muscles aren't working regularly, blood sits in your legs. That's where the swelling comes from. That's where the heaviness comes from. Here's how you do it. Stand behind a sturdy chair. Rest your hands lightly on the back of the chair, just for balance, not to hold your full weight. Your feet are shoulder-width apart. Now, slowly rise up onto the balls of your feet, lifting your heels off the ground. Hold for just 1 second at the top. Then, slowly lower your heels back down. Then, shift your weight the other way. Rock back onto your heels, lifting your toes off the ground. Hold for 1 second, then back to flat. That's 1 full repetition. Do 2 sets of 15 repetitions once a day. Now, a clinical note from my own practice. I have seen patients reduce their ankle swelling noticeably within 2 weeks of doing just this one move consistently, not with medication, just by waking up their calf pump. Important safety note: if you have significant knee pain, you don't need to go all the way up on your toes. Do a partial range of motion. Even a 50% rise will activate those calf muscles. Listen to your body. Progress gradually. Exercise number 2 is the seated knee extension with hold. And I want you to look at where this is done, in a regular kitchen chair. No leg press machine, no gym, just you and a chair. Here's why this matters. The quadriceps, those 4 muscles on the front of your thigh, are the most important muscles for functional independence after 60. They are what let you stand up from the seat without using your hands. They're what stabilize your knee every single step you take. They're what let you climb a staircase safely. When your quads weaken, everything gets harder. Here's how to do it. Sit tall in your chair. Your feet are flat on the floor. Now slowly straighten one leg out in front of you, extending it until it's as straight as you can comfortably get it. Hold that position for 3 to 5 seconds. Feel that tension in the front of your thigh? That's your quad working. Then lower your leg back down slowly. Take about 3 seconds to lower it. That slow lowering is critical, and here's why. In exercise science, we call that the eccentric phase. The muscle is working while it's lengthening. Research consistently shows this is where the real strength gains happen. Most people let gravity do the work on the way down. Don't. Control it. Do 3 sets of 10 repetitions on each leg. A word for anyone who has had a knee replacement: you can still do this exercise. You may not be able to fully extend the knee depending on where you are in recovery, and that's perfectly fine. Do the range of motion that is comfortable for you. If your surgeon has given you range of motion guidelines, stay within those. The principle of the exercise still works even at partial range. All right, exercise number 3. This is the one I said you shouldn't skip, and I meant it. This is the single leg stance progression. And I'll be honest with you, when I describe it, it sounds almost too easy. You might even think, I don't need that. But I want to share something with you first. There was a study published in the British Journal of Sports Medicine that followed over 1,700 adults between the ages of 51 and 75. The researchers had participants do a simple test. Stand on one leg for 10 seconds without holding on to anything. That's it, 10 seconds. And what they found was striking. People who could not pass that test had twice the risk of dying within the next 10 years compared to those who could. Now, I don't share that to scare you. I share it because it tells you how powerful this single indicator is for overall health. Your ability to balance on one leg reflects the health of your nervous system, your inner ear, your hip stabilizer muscles, your ankle strength, and your overall functional fitness. And here's the beautiful thing: it can be trained at any age. There are 3 levels. You start where you are. No ego, no rushing. Level 1. Stand behind your chair with both hands resting on the back. Lift one foot just slightly off the ground, maybe an inch or two. Hold for 10 seconds. Then switch feet. This is your starting point if balance is a challenge. Level 2. Same position, but now you only use one hand to lightly touch the chair, or just 1 or 2 fingertips. You're challenging your balance system while still having backup. Hold for 20 seconds per side. Level 3. No hands. Stand free. And when that feels manageable, close your eyes. I know that sounds scary, but hear me out. When your eyes are closed, your body can no longer use visual input to help balance. It's forced to rely entirely on the inner ear and the proprioceptive system in your feet and ankles. This is where you truly rewire the nervous system for balance. Start with just 5 to 10 seconds with eyes closed. Do 3 repetitions per leg once a day. The best time? While you're brushing your teeth in the morning. It adds 0 extra time to your day. The chair is right there for safety. If you feel yourself tipping, grab it. That's what it's there for. You are not going to fall because you've set up your environment to catch you. I've been in practice for a long time, and this is the exercise I wish I could prescribe to every single patient over 60. Not because it's complicated, but because it works, it's safe, and it costs you nothing. Exercise number 4, the modified wall sit. Now, when most people hear wall sit, they picture athletes in training, holding a deep squat against a wall until their legs are shaking. That's not what we're doing today. We're doing a version specifically designed for people over 60, one that builds serious leg strength without putting impact or stress on your joints. Here's why it works. The wall sit is an isometric exercise. That means the muscles are working hard, but the joints are not moving. For people with arthritis, joint pain, or anyone who's been told to be careful with their knees, isometric training is often the safest and most effective way to build lower body strength. You're loading the muscle without grinding the joint. Here's how to do it. Find any wall. Stand with your back flat against it. Your feet should be about shoulder width apart, placed about 2 feet in front of you. Now, slowly slide your back down the wall. You do not need to go to a 90-degree angle. Find the angle that feels challenging but not painful. For many beginners, that might be just 20 or 30 degrees of bend. That's completely fine. Once you're in position, hold it. Your back is flat against the wall. Your weight is pressing through your heels. Start with 10 seconds, then rest. Repeat 3 times. As you get stronger over the following weeks, and you will, increase to 20 seconds, then 30, and eventually 45 seconds per hold. Think about this for a moment. Physical therapists use this exact exercise for people recovering from hip replacements, knee surgeries, and serious falls. If it's good enough for post-surgical rehabilitation, it's good enough for us. Modification for back pain. If pressing your back flat against the wall causes discomfort, place a small pillow or folded towel behind your lower back. That slight lumbar support makes a big difference for most people. Modification for knee pain. Do not go deeper than the angle where your knees feel comfortable. Shallower angles still load the quads significantly. The goal is challenge without pain. All right, let's put it all together because I want you to walk away from this video with something you can actually use starting tomorrow morning. Here is the routine. Every single day takes about 5 minutes. Heel to toe rocking, 2 sets of 15 reps. Single leg stance, 3 reps per leg. Do this while you brush your teeth. 3 times per week takes about 10 minutes. Seated knee extension with hold, 3 sets of 10 reps per leg. Modified wall sit, 3 holds starting at 10 seconds, building up. That's it. 15 minutes, 3 days a week, with a 5-minute daily habit on the other days. Now let me tell you what to expect. In the first week, you'll feel muscles you forgot you had. A little soreness in the quads after the knee extensions is normal. That means the muscle fibers are responding. That's a good thing. By weeks 2 and 3, you'll notice you're moving through the routine faster, holding the wall sit a little longer, feeling a little more stable on that single leg. By weeks 3 and 4, most people notice real-world changes. Getting up from a chair with less effort, feeling more confident on stairs, legs that feel less heavy at the end of the day. The single most important thing I can tell you is this: consistency beats intensity every single time. 5 minutes every day is worth far more than 1 hour once a week. Your body builds on daily signals. Give it those signals. Let me bring it all home for you. Exercise number 1, heel-to-toe rocking, wakes up your calf pump, boosts circulation, and starts reducing that leg heaviness and ankle swelling. Exercise number 2, seated knee extension, rebuilds the quad strength that lets you stand up, sit down, climb stairs, and stay mobile and independent. Exercise number 3, single leg stance progression, rewires your nervous system for balance, reducing your fall risk in a way no medication can replicate. And exercise number 4, the modified wall sit, builds functional leg strength and endurance safely, using your body weight and a wall as your only equipment. 4 exercises, 0 equipment, 15 minutes. I want to say something directly to you right now, and I want you to really hear it. At 60, at 70, even at 80, your body still responds to the right signal. The science on this is clear. Muscle tissue responds to resistance. The nervous system adapts to balance challenges. Circulation improves when muscles activate. None of that stops just because you've gotten older. What stops it is inactivity. And I know some of you are watching this because you've had a fall, or you've had a close call, or someone you love is struggling. I know some of you are watching because you're scared of losing your independence. I understand that. I've sat with patients who felt that same fear. These exercises are not a cure-all. They are not a substitute for seeing your doctor. But they are some of the most evidence-supported, accessible, and effective tools I know of for helping people over 60 feel stronger, safer, and more confident in their own body. I would not recommend anything to you that I wouldn't do myself. That's my commitment to you. So here's what I want you to do right now. Pick one of these 4 exercises, just one, and do it today. Not tomorrow, today. Even if it's just 10 seconds of standing on one leg next to your kitchen counter. That's your starting point. Everything else builds from there. If this video gave you something useful, please give it a thumbs up. It helps more people find this information when they need it. And I'd love to hear from you in the comments. Which of these 4 exercises are you going to start with? Tell me below. I read your comments and your stories matter to me. If you haven't subscribed to Healthy Aging America yet, hit that subscribe button and ring the bell so you don't miss what's coming next. And speaking of what's coming, our next video is one you won't want to skip. 5 warning signs your legs are aging faster than they should. Some of these signs are ones most people brush off, and they shouldn't be. I'll link it right here when it's live. Until then, take care of yourself. Move a little every day. And remember, it is never too late to get stronger. I'm Dr. Alan Mandell, and I'll see you in the next one.